very, very revealing about how, when we're looking at schools and opening up schools, how to do things, maybe a little bit differently for elementary versus more of a virtual platform for secondary. The importance of what's called cohorting. So if you're in elementary school, your first grade class is your first grade class for the entirety of the year. And you don't interact with other first grade classes. You don't split, you don't switch between teachers and things. Importance of cohorting, which is very difficult in a secondary situation. So those are, I guess, the big things going on right now. Questions for me?
With the cases that you're seeing, obviously we've seen a surge in positives, but are we seeing more people who are asymptomatic that, other than testing, wouldn't know they're?
It's the same. I mean, again, the estimations are anywhere between, yesterday there was something that came out about 40%. So we don't always, when we're going through the questioning and all that, we don't always ask, are you symptomatic, asymptomatic, and things of that sort. But again, I think the ballpark figure is, expect about 40%.
The asymptomatic?
The asymptomatic, yeah. Asymptomatic, or, the biggest concern by far and away are what we call pre-symptomatic individuals. So these are the individuals that your peak viral load occurs just around the time that you become symptomatic, if you become symptomatic, but you're asymptomatic at that point. And so there are people walking around that are very contagious. And oh, by the way, tomorrow I get my symptoms. I didn't know that. And therefore, the other thing we're seeing is that, and again, it's a statewide phenomenon. It's not just businesses. I think businesses at times get faulted. It's what people are doing in their backyards. It's what people are doing at the park. I had that photograph from looking at Liberty Lake, the beach at Liberty Lake 2 weeks ago, and it looked like Florida. And when I contacted Doug to do something, well, you know what? The beach filled up by 11 o'clock this weekend, but it was limited, mind you, but they still limited, but it was party like there's no tomorrow. So the messaging just has to be, folks, we can control at some level what happens in businesses. And I think a lot of the businesses are doing the right thing right on. It's what people are doing when they leave businesses, when they go home. I was in Comstock Park this weekend, and if there was a barbecue of 20 plus people, none of whom were distancing, none of whom were wearing masks, it's just, so I'm going to talk with Garrett about what do we do in the city parks. So I think, again, it's the messaging, it's what you're doing at work, it's what you're doing at home, it's what you're doing at home, it's what you're doing at home on the weekends, folks. And don't go to Idaho and party, because you're going to cause people to get infected over there, and you're going to bring it back over here. And it's just, yeah, it's exasperating. It really is. When I look at our cases right now, that at the state level, we have more cases now than we had during the peak back in March and April. When I look at our overall positivity rate, there's nothing, the only county that's doing better is Yakima. And it took them 6 weeks after they got really strict with masking and things. Our trajectory is at the state level is really concerning, and at the local level is even more so. Kootenai yesterday, 19 hospitalizations. So 19 hospitalizations, 3 ICU. Where do they go? They come over here. Yesterday we had almost 50 people in the hospital, between local residents and from around the region. That's the most we've had at any one point in time. So there's a lot of concern about hospital capacity. It's good, but it's going to be stretched. And as it gets stretched, that means that you want to go in for your elective gallbladder surgery. Well, let's put it on hold. If you have a knee replacement, well, let's look at December. And that's not a good way of functioning. So.
Do we still have a number, Doctor, of folks from Coyote Ridge in the hospital?
It's, honestly, Jerry, that's backed off pretty considerably, which is reassuring. Yeah, they had their peak. They went in and did testing. Department of Health worked with them about 3 weeks ago, 3.5, 4 weeks ago, and did testing. Only had a couple more cases. So we were in a conversation with Airway Heights last week. They were interested in finding out what if they were to do more focal testing, what kind of resources we could bring to bear for them, but they've not been seeing the influx from Coyote Ridge, which we're very thankful about. Okay, thank you.
Okay.
So, Dr. Lentz, I have a question.
Yes, Commissioner Koenig.
Thank you. So when you first started talking, we didn't catch all of that. And so, so did you get an article on South Korea and school reopenings? Because with Ben Wick and I being on Central Valleys, it'd be great if we could get a copy of that, if you could email that to us.
Yep. I will plan on doing that this morning.
Okay, thank you very much. And then again, just kind of, I know you're going to meet with the superintendent, so if you could kind of just give us an update, maybe tomorrow after that meeting, that would be great.
Okay.
Thank you.
Okay.
I guess I have one more question, sorry. So I'm not sure if this is for Dr. Letts or Amelia for you, but so one of the concerns I have is that as we see the numbers spike, that we're not updating our website on the weekends. And I think that's really important for all of us because I'm getting calls on the weekend thinking I've got inside information as to what the numbers are and all that. And I think the public just, honestly needs to know what the numbers are. And so I don't know if that's,
Yeah.
providing funding. So I would just want to put that out there that I think that's a really important thing as we are seeing numbers continue to, bounce up and down and all of that. And particularly as, I keep telling people, to get schools open, which is so important, which may not happen if we don't get our numbers down. So I mean, I keep trying to reiterate to people, and I think having those numbers on the weekend would be, really beneficial to all of us.
So I can speak to that a little bit, Commissioner. One of the issues that we have is that in order to put those numbers out, we have to have staff here by 5 a.m. on the weekends in order to go through all of the reports and get everything scrubbed so that we don't send out privacy information because of that. And, the comment that I was going to make after Dr. Letts was speaking, all of the numbers and all of the number spikes, what that really interprets it for the health district is a lot of people hours around contact tracing. So when we don't have support or we know that there are going to be events or things that are huge amounts of people, we have staff burning out. Because I think they're starting to feel like it's futile, right? And so one of the things we were trying to figure out is what can we reprioritize in order to give staff a little bit of a break. We do have, I think, 11 more disease investigative specialists beginning next week. I think it's either next week or the next week. We have to get them through orientation.
The next couple of weeks, by August, we'll have them on board.
But I mean, I just don't know how. I don't know that we have the power, the human resource power, to keep going on the weekend. Sometimes, I've got to figure out how to give people a break. That's why we pulled back on those numbers, because we were already running at a 24-hour, I think, lag. So this is a 48-hour lag. And I know it's not ideal. I know people want the numbers, but I've also got to keep staff healthy to go through. So it's not that we don't want to. I think it's something we can revisit once we have more staff on board. But I got to have a little reprieve there. Okay,
and I can understand that. I think we just need to see what we can do then if you're ramping up more, what we can do to get there and just kind of have that be one of the things.
For sure.
Yeah. Thank you.
Yeah, I think once we have the additional, because it's 11 and 10 or 11. 10. Okay. Because we're hiring both disease investigators and some more epidemiologists. So we've got both. So that should help us.
I have a quick question.
Sure. I don't know who. Oh,
This is Doug Ross. I'm the city administrator at the city of Medical Lake.
hi, Doug.
On the, posting the testing results are great and all that, but it feels like it's sort of preaching to the choir. It's like, how are we going to reach people who aren't listening and aren't wearing masks and aren't doing those things? I feel like the people checking the website, those are probably people who are abiding by the rules anyway. It seems to me we need to figure out, which is an obvious statement, but how to reach those people who don't do those sorts of things. And we're struggling. We have a city park, like Dr. Lutz was referring to, that's just packed on the weekends. I don't know what to do. Do we close the park? Is there going to be an order coming down to close parks from public health at any time? So I just feel like I think it's great you give your staff a break, and I just think the people who are obeying are probably the ones checking those websites in the first place. How do we reach the other people?
Doug, I mean, I think you have a very valid point. It's something that I, as well as communications, are definitely struggling with. I will also share with you it's a struggle at the state level with communications. Yeah, I mean, the messaging, it's not resonating. It's not resonating with the people who, or they don't care. I mean, I had some people tell me the other day, they're just tired of it. They're done with it and they're ready to move on. And unfortunately, that attitude only perpetuates the cycle. So, yeah, and I hate the enforcement piece. I really hate the enforcement piece. But for example, at the county park at Liberty Lake, that's what we did. They have somebody at the front gate. You just limit the number of people that come in. That was easy to do. In your park, it might be a more difficult situation, but if it means that we have to shut it down to prevent people from gathering, then so be it. So, educate, but if you can't educate people to do the right thing, then at some point, then you need to be a little bit more strict. And if you need me to do that, Doug, I'm not happy to do it, but I will do it. Because again, it's that kind of behavior. There was a photograph that was shared with me by one of my colleague over in Seattle, and there were 20 power boats in Lake Washington on the weekend, all tied together, and all of these young people running across the boats. And, right now, 35% since Memorial Day, 35.2% of our cases are in 20 to 29-year-olds. If I add 30 to 39-year-olds, 49.6% of our cases since Memorial Day are in the 20 to 39-year age group. The messaging we're doing is not working. And, I was talking with Alicia about trying to get businesses to weigh in. I had a great conversation with Rose Hours this past weekend. And, they have, when I was at their boardroom, they've got their mission statement, and it's to the community. And how do you get individuals who do the right thing at work to do the right thing when they go home? Commit to the community, commit to your employer, commit to yourselves to do the right thing, because otherwise we're going to be stuck indefinitely. And to Commissioner Cuney's point about opening up schools, it's going to be really challenging to open up schools with our current trajectory. At some level, you open up schools, that you will get more transmission, that you will have more infection. The rhetorical question is, how much more infection can we tolerate? How much more can we accept? Because all the evidence shows that you open up schools and you do open up Pandora's box to a degree. How much can we accept? Right now, that's challenging. Our R0 is about 1.5. It needs to be below 1. And it's going to take quite some time to get there with our current trajectory. So, Doug, as I said, feel free to reach out to me. More than happy to talk to you more about it.
I will. I'm going to send you an email. You'd cringe if you saw our park. Unfortunately, we don't have a gate we can just close. I think we're to the point where people just aren't going to do it, period. That's my huge concern, that people just aren't going to wear masks. I think the education has been great. I mean, the message has been getting out. You have to have your head in the sand if you haven't, been told about masks, etc. I'm very fearful we're just to the point where people say, I'm not going to do it. I don't care if there's 500 cases. I'm just not going to do it. And I don't know how you reach those folks.
Yeah, and I think the concern, Doug, I think the concern that we all have to accept is that, one of the options that's on the table that is not a good option, but it does exist, is that we go back to stay home, stay healthy. And that is not a healthy option, but if we can't get things under control, that is on the table, which is unfortunate, but that's our reality. I mean, the modeling that was done this past weekend, Doug, was really disconcerting. It essentially has us about 3 weeks behind Florida with the cases, but more importantly, the hospitalizations. So 3 weeks behind what Florida is dealing with right now, given where we're going, given the behaviors. And it's not just work sites, it's what's happening in people's backyards. So I think your point is well taken, Doug.
Thank you.
Okay, any other questions or comments? Not seeing anybody unmute. So, Steve, do you want to walk through the dashboards?
Yeah, and good morning. And before I go into the nitty-gritty data, I will share an uplifting one, at least from this past weekend. So for the past few weekends, we've had some volunteers going and observing folks walking into larger stores to see if they are following the masking protocol. And in the past 2 weeks, it's drifted somewhere into about 60% of adults are wearing masks as they go into the stores. But in this past weekend, with the most observations we've had at 735 observations at 18 total locations, we hit 93% of individuals walking in were wearing masks. And that was split evenly between genders, where before it had definitely been males were less likely to wear masks. So one piece of good data that's coming out of this, which is nice to see. For the week by week kind of analysis, so in the past week, we had 631 cases, new cases. That was 167 more than the previous week, with a daily average of about 90 as opposed to 66 the previous week. The age group that is still bringing in the most new cases is that 20 to 29-year-old group, followed by the 30 to 39-year-old, just as Dr. Letts described. When it comes to the cases by race, we're seeing a lot of other unknown that has to do often with just the lag in information that we're getting with such a high caseload, trying to get all the details from the individuals. That's still the highest group, but then white and the other groups that have been disproportionately impacted are still moving down from at their peaks, with the Pacific Islanders at about 4%, Hispanic at about 4% as well. For our hospitalizations, we had 13 new hospitalizations last week. The previous week we had more, 20. They continue to be in the older populations, but we did have an individual in their 20s and an individual in their 30s. We have 31 currently hospitalized. Unfortunately, as well, there were 2 deaths in this past week, a male in the 90s, a male in their 60s, with none the previous week. Our testing, the number of individuals tested for each new case was 11.5. That's still under our critical metric of 50 times the number of new cases. And our daily average tests were 662. For the healthcare system readiness, the current percent of licensed bed occupied by patients, and that's all patients, is 58.5%, which is great. It's meeting our goal of under 80%. Our total number of licensed bed in Spokane County is 1,531. The percent of licensed bed occupied by COVID-19 patients as of yesterday is 4%, which is meeting our goal of less than 10%.
Could you repeat that number? The sound cut in right as you were given that last stat.
Yeah, definitely. The percent of licensed beds currently occupied by COVID-19 patients is at 4% as of yesterday, which is meeting our metric of less than 10%. For case and contact tracing metrics, these are the timeliness ones, and I do need to put the caveat in that these are only for the cases that we at SRHB are individually investigating. We're also partnering with the Department of Health, and their metrics have not been shared with us as far as timeliness goes with our local cases. But of the cases that we are investigating, 81% are reached within 24 hours, and contacts, 90% are reached within 48 hours, which are the two metrics we are looking to hit, with 80 and 80 being the goals. We're still on that. In addition to that work, just some metrics coming from SRHD and the work that we are providing to the community. We have a care coordination branch that is helping with individuals who have identified needs. Those can be anything from food, housing, to working with unemployment, to just getting general like medical support. So far to date, and this grew launched about 2.5, 3 weeks ago, we have worked with 100 cases, and those can be households as well. So we've worked with 100 different households, which was an increase of 14. So we had 14 new households that we worked with last week. We currently are working with 57 cases. We consider it an open case when they are still under their isolation or quarantine period or need additional resources. And we closed 4 in the past week. So they're doing a lot of work out there, getting involved in the community. For community-wide metrics, for food security, so new EBT applications were at 534 last week, or actually the week prior. We're 1 week in delay because of reporting, which was a slight increase from the previous weeks, but still below our peak at 707 applications per week. Second Harvest, their distribution was at just about 490,000 pounds of food distributed in that previous time frame. That has gone down since our peak back in early June. And then for childcare metrics, the percent of childcare center or family centers that are currently closed is holding steady at 26%. That's been the case since about June 15th. Our birth to 5-year-old programs that are closed are 18, so 1 more closed over the previous week. Our programs for 5 to 12-year-olds that are closed is at 81, which is reaching a high level. And then our vacancies in childcare has gone down slightly to 1,064 slots. And that is it from my updates.
Todd has a question.
I guess more of a comment. I know we're at the Sheriff's Office monitoring a lot of different things right now, everything from protests in the Northwest to what's going on with COVID. One of the things that we're deeply concerned about is, I think is it this week that the additional 600 in aid from the federal government goes away. So concerned about, when you start adding up resurgence of COVID, people that just say they're done with it, tired with it, frustration's growing. We have protest frustration going. And then if there's further economic frustration going because of inability to meet needs, for all those reasons, we're watching it carefully. But one of the things that we are very interested in tracking right now is kind of the status of the food distribution piece. Just kind of, it's like, okay, where do we start with kind of essentials for the mass population? And so, so we've kind of heightened our interest in trying to track that. And so I was going to reach out to Natalie. I was going to reach out to Second Harvest as well, see if they're doing anything. I was also going to reach out to some of the food distribution, food retailers, grocery retailers, to kind of see if they're seeing anything in supply chain. Just out of curiosity, on my way into work this morning, I did stop at 2 grocery stores just to kind of walk up and down the aisles and see if I noticed anything with regard to supplies. Mm-hmm. And you're starting to see chunks on the shelves that are empty again. Mm-hmm. Most notably, canned foods is what I picked up a lot. I should say I picked up a lot, but I noticed a lot. So just like I say, trying to be aware of those trends and seeing what type of impacts they potentially would have on this community.
And we'll continue to report those. Those are the numbers from Natalie that she provided to me. Mm-hmm. Distribution. Mm-hmm. Perfect.
So you're saying we're still down on the demand?
We've gone down slightly. We've gone down by about 40,000 pounds. Mm-hmm. But we're in a week lag in the reporting due to furloughs and just a backlog and trying to get the data cleaned up. So.
Do we still have the National Guard helping with packaging? I've lost track of that.
I don't think so. I think they were gone.
Okay.
I was going to, similarly to Todd, I was just going to say that I think on food distribution will be interesting, especially since you have a week leg anyways. This weekend will be the last check that the 600 additional check they receive. And so we may not see for another, about into early August. And so some just thoughts around just being able to be aware of that on both some of the child care issues and some of the, a lot of concern around that.
And I think as we get closer to the school year, or when, depending on what that plan becomes, around childcare, like what's that going to look like? So that'll be interesting as we continue to watch, getting closer to September. Any other questions or comments for Steve or for the numbers? All right, Alicia.
Yeah, good morning, everybody. I don't have too many huge new updates, a lot in progress. I would just say first a thank you to Dr. Lutz on conversations with handfuls of employers. Are working through a lot of, it's a combination of compliance, L&I, enforcement around masking, employee safety issues, and a lot of inconsistencies around understanding some of that. So just, there's a lot of work to do there, and I think to Dr. Lutz's comments earlier, I think that there's some continued opportunity, and we just had a board meeting yesterday, and a lot of our, not every employer, but I think there's a lot of our significant employers across the region who are continuing to want to be able to be part of this critical solution and really concerned about what we're seeing, what's happening, all of those kinds of things. And so just a lot going on in that space. And then I'd say that we're in the midst of, what's the right word to use? Creation and design. So we're on target for the county small business and nonprofit grant program to open next week. And so in the throes of all of that design and kind of finalization of all of those parts and pieces, the intent right now is that we will, it'll open on Monday morning, and it will push it out through Facebook Live here on Monday morning. And then the Spread Kindness, Not COVID's kind of social norming campaign components and all this began to drip this weekend, and will be continued. There'll be pieces in all 3 major print publications, Spokesman Review, Journal of Business, and Inlander, every week through the remainder of the year, and then many other assets that are coming online this week and over the course of the next couple of weeks. But what I'd also say most importantly, and a little bit to this idea of encouraging our employees to be part of our community solution, and the public, is that there's a business toolkit already out on the Kindness Not COVID website that's free, downloadable, and we'll continue to add tools and assets to that, and just encouraging folks to be part of that solution and messaging. So I think those are the major updates. I'm happy to answer questions, but we're kind of all hands on deck around those components right now. Thanks, Alicia. Any questions for GSI or for Alicia?
Hi, this is Tanya. Alicia, are you going to be gathering certain kinds of information from these businesses that are going to be applying for these grants, just for the sake of analysis?
We are going to be gathering lots of data on those businesses, yes. We're working through finalization of the application processes, because it'll be kind of 2 dual applications. So some of the information is the same, but certainly a little bit different for if you're a nonprofit organization or a business. But we'll have, so depending on which data you're interested in, we'll have a lot. We're also building off of the data we've already been gathering through the Commerce Small Business Grant process initially. And Commerce is also going to be distributing another round of funding probably in early August to support as well. So we're working to make sure that all of that data continues. It's the same data. We also gathered all the same data or similar when we did PPE distribution as well. So we have starting to really source a lot of information about our small businesses and nonprofits, needs, gaps, etc.
Okay, I'm wondering if hopefully you're going to be collecting some employee data as well. I mean, we're still going to have, we're only in phase 2. We hope we don't slip to phase 1, but that also means that we have a lot of our folks out there that simply aren't working and don't have the ability to work. And there's only going to be so much that we can do to support our businesses in terms of not going bankrupt. But I think what we're going to start to see really in August, if we don't get to a more robust phase in a safe manner, is you're going to start to see the eviction protections go away and the $600 additional for unemployment goes away. So it's going to be a double whammy for our folks. And yet we're still not in a business point where these folks can safely go back to work. So I'm kind of interested really, and it's just me personally, interested to see what kind of businesses are really opening and what they're doing and how they're generally surviving. But I think in August, we're going to start seeing a lot of other businesses that have not had the ability to open or open fully, and we're going to just start losing them.
Yeah.
And we're going to start seeing a lot more individual impacts.
Yeah, so and we can offline if there's some specific thoughts around employees, but I said there's a couple of data points we've continued to gather. One is how many employees did you have, pre-COVID and now as you're applying. So we're looking, all of the focus of the grants is around, impact as a result of COVID. And so there's very specific around loss. So either loss of employees, loss of revenue, or increased expenses as a result of COVID because they're doing something more, thinking about the food bank as an example. So there's questions in there around that. And then I'm trying to think through a couple of the other, there's a few other kind of, they also have to talk about, there's a little bit of it, there'll be a narrative question around kind of their plan and their realities. And then there's a questions both that we've already gathered and we gathered for PPE distribution and we'll gather here. Are you open? So were you forced to close initially by a mandate? Have you since opened or are you still closed? So we'll have kind of that trajectory as far as their open and close rates or realities. So those kinds of things are all part of the questions on the application.
All right, thank you. Yeah, if we're not to that point, what I would start to see come August, and we had hoped we'd be there at least starting into phase 3, is cities and the county are definitely going to start to lose more in sales tax revenue and some of our other business revenue tied to that. I'm just overly cautious here.
Yep.
Alicia, when does the application go live on the website? I thought it was up, but as I'm looking, I'm not finding it on the website.
Commissioner, it's the date is that it will be live on Monday, the 27th.
Okay, I'm sorry. I thought it was supposed to go live yesterday, but okay, sounds good.
No, I think since we it had that extra week to figure out for sure parameters, we pushed back 1 week.
Okay.
We are intending to send out a press release, and Kara can correct me, but on Thursday, and we're in the process of setting up a webinar, a series of webinars that will occur on Monday and Tuesday next week. So that'll all be part of the press release that goes out on Thursday.
Yes, that's right. On Thursday afternoon, we're hoping to put that out, and it'll include links to an FAQ that will be dynamic on our website and the eligibility requirements. And then the link will go live on Monday morning for the application.
Thanks, Kara.
All right. Any other questions, comments, concerns? Just a reminder again, if you have a topic, a burning topic that you want us to give to Dr. Wiesman for when he joins us next week, please email or call me with that. And I'm not seeing anything else. So with that,
can I say something real quick? This is Doug with the City of Medic Lakes. Sorry for talking so much, but I want to thank Dr. Lutz, and I think it's important that we appreciate what he and his staff are doing. He didn't create this virus. He's not spreading this virus, yet he seems to bear the brunt of it, as do a lot of elected officials. So I think it's important that we always, remind him that we appreciate what he's doing. I can't even imagine. I'm tired of this. I can't even imagine what he's going through, what Wes is going through, and the rest of you. But I want to thank Dr. Lutz, and I think it's important that we appreciate what he's doing. It's got to suck, quite honestly.
Thank you, Doug. Yeah, I think we all share those sentiments. It's a lot of pressure and a lot of hard work. Absolutely. So
Amelia, I've got a comment that I want to make, just to put this out there to see what people think. So I was talking to somebody who's a web developer or an app developer, and I see pros and cons to this, so I just want to throw it out there. But as we try to think of what are the ways that we can try to get people to be doing the right thing and all of that, in addition to the public and PSAs on spread kindness, not COVID, would we look at like an app that people can go into to rate a restaurant? I mean, I've gone out to several restaurants to see who's doing it right, who's doing it wrong, what additional things are happening. Would we want to look at something like that to have people be able to go in? It's kind of punitive for the businesses that aren't doing it right. I mean, because they're certainly not going to get rated well, but it's helpful to the other ones. And would that help kind of publicly shame, which is not where I want to be, but it's like we need to get our numbers better. And so how do we do that? And would that be a way to look at, one more piece to help get people, wearing their masks and doing all the cleanliness things that they need to be doing. So I just want to throw it out there to the group to see what people think. And people don't have to comment today. We can, people can email, back to you or I, but that's just something I think is, the only other thing I can think of as we try to think down the road as to what can we do. It's not super expensive. It's, to do something like that, but I think gives, might give people a way to, give an opinion on a restaurant or on a venue or something.
Like Yelp for COVID.
Yeah, so Commissioner Katie, I think they're great questions, and two things, and Kara may have more insight, but we can do some follow-up as well. So, and I don't know if Dr. Lutz might know, but you have the Spokane, I think they're calling themselves now the Spokane Restaurant Coalition that Mark Starr has been leading, and they're organizing pretty well. And that I think that's some of their conversation as far as tools to help promote the businesses that are doing, the restaurants that are doing it well. And then additionally, with the work that the Inlanders doing, there's a few different components around really highlighting restaurants, hospitality, those kinds of things that are. And some interactive in that, and so we can follow up with Jer on the specifics. But I think some of that either may be underway or could be part of a piece of what the work that they're already doing.
So this is Kara, and I'll just add to that. So we are on the kindness campaign on the kindnessnotcovid.org. There's a kind of area that a business or somebody going to a restaurant or a business can comment on a particular business. I would, as much as people are using Yelp for that, which is a review platform for all types of businesses, but most commonly used for restaurants. It's interesting because there's a libel issue on that as well that has played out over the last couple of years about, folks just kind of getting back at companies. So I'm not sure. I'd be hesitant to do that as opposed to kind of lifting up the ones that are doing it right. Are the folks that fill out stories on the kindnessnotcovid.org site, we share with the Inlander. We're hopefully going to lift up those stories that are doing it positively and well. I would just personally be leery about one that's punitive. I'll tell you just personally what I've done twice is I've called a business and I've let them know that I won't be coming back because of what they're doing in their business. And then I'm giving them one call. And if I hear about it again, I'll report them. That's that's all I can do from a personal standpoint. I talked to a gal last week, and she had some confusion over the masking, and if she's able to tell people that she needs a mask coming in, and she told me that she won't have her employees do that. So it's just there's all sorts of opinions and perspectives out there that lead one to not mask or not require others to mask, and that's a huge challenge to try to get around. So yeah, that's just my rambling thought on that.
Yeah. No, and it is. But then I guess I would say so maybe you guys need to do a presentation on that, because why do I as a commissioner not know that I can be going into that website to do these things, to say which businesses are doing it right? So that's, again, within a few small people that know about that, and we need to get that out to the broader group then, to know what we should be doing or not doing, doing, because I mean, I haven't seen any of that. I don't know of any way for me to lift up a business. And so maybe we need to be talking about that, that it's not punitive, it's lifting up a business that's doing it right. But I think that's something we really do have to talk about. I mean, because like when Dr. Lutz was talking about Liberty Lake, I mean, I had a constituent was the one who sent me the picture of saying, COVID Lake, that then got Doug Chase and Dr. Lutz, to look at what we need to do there. So people are contacting us as electeds, and we need to give them opportunities then to not just look at the bad things, but also help them, guide them as to what they can do for good things for businesses.
Right. Those are all those things in the works. So those will be in the next couple of weeks, what we're working to launch.
And I guess I'd say as soon as we know, the better. Because again, as I look to schools, we don't have 2 weeks to wait on some of that. So as soon as we can know things, an email or something just to let us know what we can do or not do.
Most definitely.
Thank you.
Thank you. It looks like Jerry maybe has a question or a comment.
Well, I was thinking that kind of along what you were talking about, Mary, if you look at these numbers, especially with the young, the cases that are confirmed keep going up, and I don't mean to sound cold, which then drives the death rate down. And if I was a cynical 30-year-old, I'm looking at these figures, go, oh, there's probably 10 times more people that have this that have even been tested positive. And I'm zeroing in on the death number and the hospital number. I don't have any sense of crisis to this. So maybe the messaging or part of the messaging should be directed at them. For instance, I heard a young person say over the last weekend, we should have just let the herd immunity take its own course. We're all going to end up in the same place Sweden did. It's just going to take us a lot longer to get there. Well, if that's your attitude, how motivated are you to wear a mask?
Well, and I think that's been part of the who do you wear the mask for campaign.
I think that's really important.
Right.
You love your grandma, you love,
Right, because it's really more for that age group who they're taking attack to. Right, so like if you're in that 20 to 29-year-old range and you have older parents or you have grandparents that you're interacting with, those are the folks that you could end up, you're the vector to them.
maybe at some point in time, a special, maybe Dr. Lutz could do it or something, kind of a special message targeting instead of the masses. We target business with certain things. Say you're the epicenter of this whole thing. You 20 to 29-year-olds. This message is directed directly to you. Whatever, I don't know what the message would be, but somehow to get them motivated, to not go to Idaho and party on the weekends or whatever. Because obviously, if you look at from the week to week, something it's accelerating in that age group. It's not, the message isn't getting through to them.
Are our higher ed institutions helping at all with that message? That's obviously not all of the 20 to 29 population, but
It's a lot of them.
are they have we asked for their engagement and are they still communicate with all of them?
I know that Dr. Lutz has had conversations with WSU and Gonzaga, so let me follow up on that.
I just think that they hold all those, not just on, they don't just communicate on email with them, they communicate on all those social platforms with them that whether they're in session or not, and they're carrying backup for whatever, you know, it's gonna look like in the fall. And so, could they be a part of that? Or even using some of the coach power, right? Some of the people who work at the universities who are popular or get like coaches or something, talking to them, that might be a way.
Well, the young parents, you know, I mean,
Yeah.
I'm not suggesting the parents, they don't love their children, but I'd be motivated to do something if I had all my kids another year of homeschooling. What do I need to do? Hell, I'll staple a mask to my face if it helps you,
Right.
to get these kids back in school, so.
Right.
And I will say that we are now seeing it dipped a little bit lower, but we're starting to see a steady but gradual uptick in the 40 to 49, 50 to 59.
So the parents bringing it home.
Yeah.
Teenagers.
Yeah.
And that's the cycle we're going to expect, is that it's younger, it's going to go to the older, who will then pass it on to their parents.
So, I mean, I think part of it, we have to be a little bit careful on the messaging. So I don't think it's so simple as to simply say, well, Washingtonians shouldn't be going to Idaho. And the reason why is, I mean, I'm most familiar with Priest Lake, and I would say a good 80% of the homes at Priest Lake are owned by Washingtonians. And you're not going to be able to tell people they can't go to their property. In fact, some people, that's where they're finding kind of their ability to recluse, if you will, escape. And so they're going up and they're maintaining their lake places and hanging out there. I mean, if you can work remotely and you know, good luck getting internet connections that are dependable. But if you can do it, great. And I think that's what a lot of them are doing. I mean, I know a lot of teachers that typically would be up there in the summer, and they just got a 2 month to 3 month head start this year and stuff. And so I don't think it's one thing to say. I think it's one thing that we got to be careful. Just say you shouldn't go to Idaho. It's like, I'm going to go to my property. I'm going to go to my home. I pay taxes on it and stuff. And my observation when I go there is a lot of the businesses, they might do outdoor live music, and you see the tables are spread out, I mean, further than we are. And you might have a group of 4, you might have a group of 6, you might have a group of 2 and stuff, and they're just scattered around. And I think most of the adults are doing that. But I think when you take a look at the age group of, I would say, the 16 to 30-year-olds, you know, those are the ones going out in the ski boats that are rated for 12 to 14 and have 18 kids hanging off the side, and they're wakeboarding and all that. And so it's not even the masking. It's going back to the fundamentals that we started with way back in March, which was the social distancing. And so I think our marketing campaign has really got to figure out, you know, what resonates with that group, and start with the basics, which is, you know, hygiene and distancing. And then, you know, if we can find somebody that resonates with that group, maybe it's their peers who've been sick. You know, maybe it's, you know, not all of them are athletic, so student athletes maybe it doesn't resonate with all of them, but I think that's where we're struggling in the community is with that group, and the messaging isn't resonating. And I'm not seeing that it's not like they're social distancing and they're hygiene, they're just not masking. They're not doing what we started with, which was, you know, the social distancing.
So let me, for our next meeting, I know we'll have Weisman, but I can also have Kelly come in, our PIO, and talk about what we're doing with social media related to that group and different things, so she could provide an update. I think that would be helpful.
Because I mean, I think they are the spreading group, because like I say, you see them. I can't tell you, last weekend, probably 3 different ski boats that I went by on the lake, and there's 3 of us in our boat, and there was 18 on those boats, you know, and stuff. And they're the ones that, at the end of the day, they're going back and infecting mom and dad. And so I think that's why you're seeing the surge with the little bit slightly older group, which would be about the parenting age. So,
I think if we're being totally honest, you can beg that age group all you want. They're not going to change. You're going to have to figure out something to take from them that's important, I don't think you're going to get the message through until you do that. So I think messaging is great, but you can beg them all you want. You can guilt them about their parents. I still don't think that stops. We're just going to have to figure out how you take something from that age group that's important to them. whether it's
Well-
bars. I don't know what it is, but I just don't see them changing until that happens.
I mean, I agree. I think it's the parents' creed for raising teenagers is, find out what they value this week or today and be prepared to take it away and know that it's always changing. So,
Yeah, and I wish I had the answer to that, but it's going to have to be punitive somehow. It's too bad we can't take their phones or something.
that way they
But-
can get.
That's in my humble opinion, being a 22-year-old at one point in my life, you can beg and beg and beg, but it really is that thing that really personally affects them is the only way that I think we're going to get through to this. I think the point about death rates was a great point. As twisted as this sounds, I think with death rates being so low, it's not helping. I know that's horrible to say, but I think you get a lot of people who say we've got all these cases and our deaths have only gone up by 4, so it must not be that bad, and that's kind of scary.
So I think we have time. Commissioner French, did you have a question or?
Well, I just wanted to piggyback on what Doug was saying a little bit. I mean, parents have had 18 years to influence their kids and all that. I mean, it's almost a point of defiance to show their independence. So, it either has to be a reward or it has to be punishment to be able to get their attention. I don't know which one I'm really going to side on. So anyway, just a thought.
All right, well, we are at time, and so we have a meeting scheduled same time next week, same place. So again, just a reminder, if you have questions for Dr. Wiesman or topics, please send those my way so that we can add those to the list. And thank you.
Thank you.
Thank you. Yeah.